regardless of what we use now or in the future, going back to monitoring these patients, you know, the comments about maybe dose reduction or increasing the dosing interval, how often would you get these patients back into your practice to evaluate them? What is appropriate monitoring? Okay, two parts to this question. What is appropriate monitoring for adverse events, and what is appropriate monitoring for efficacy? How frequently should we be seeing these young patients back?
I don't know that we have the answer. I don't know that. I don't know.
We need an answer.
I think the answer is probably more than we do.
Yeah.
More than we do, okay.
Yeah, I think that's reasonable. I think it's probably a case-by-case basis, but you know, certainly if you have these young patients that you're starting off on therapy, you know, in the beginning you're going to want to see them more frequently than once they're well managed and established. And then by the time they're in the more geriatric age, you're probably going to want to see them more frequently than you did when they were cruising along, you know, in their middle ages.
So let's say you diagnose, you start treating a young dog. Is there when should you first see that patient back?
A young dog.
Young dog. And we're talking about here, it's got to be a practical combination.
So we're just seeing the dogs who started maybe on some non-steroidals.
Right. Assessing for side effects, assessing for efficacy.
So I'll answer that question. Because we know that looking at the data with non-steroidals in dogs with demonstrable OA, it can take up to 2, 3, sometimes 4 weeks for in a given patient for the non-steroidal to exert its maximum effect, or any effect really. And that's because some of these dogs have a central and peripheral sensitization component that has to kind of wind down, if you will, before the clinical effect is really seen.
And maybe even a learned component.
And a learned component, right? So they're avoiding certain behaviors, correct? So I think that a month is probably a good target time period, that the drug trial actually lasts at least that time. And that is a good target time to see them back and continue the dialogue with the owner going forward. In the meantime, be considering introducing other modalities. So the polysulfated glycosaminoglycans would be right up very, very high on my list. The EPA-rich diets, very, very high on my list. Weight optimization, top of the list, besides the non-steroidal.
So you're saying see them back first time at a month?
That would be a reasonable target to do.
And then how often after that? A young dog?
Yeah, that's a good question. Maybe in 3 months again, and then 6 months, and then see them at their yearly exam. Maybe that's a good target. I don't know that we have a set thing. I think you probably have to take that in case-by-case basis. But I think we're going to find a lot of owners appreciate that type of early management and investment in them and their patient, investment of our time and our interest and our concern about how we can affect a change later in life.
Yeah, I mean, I think something that always needs to be brought up is that, you know, it would be nice to see them more, and we have a lot of good things, but there's always has to be the discussion on if you're going to start all this in a very young dog, there's a financial investment by the owner, and that is not always something that every owner can absorb. And so I think the economics of these diseases for the owner, I mean, they have other things in their life that need to be paid for, and the dog might be, or the cat could be extremely important, but the financial investment in this disease for the owner can be quite extensive and challenging for them.